వాసెక్టమీయా అదేంటి?
నేను ఆపరేషన్ చేసుకుంటే పనికి ఎవరు పోతారు?
I might become less of a man.
जब बच्चे वो पैदा कराती है तो ऑपरेशन भी वही कराए.
అది చేసుకున్నప్పుడు సెక్స్లో ఏం హ్యాపీగా ఉండదు.
Reflecting upon societal beliefs forces us to ask, to snip or not to snip? That is the question.
Vasectomy is a simple surgical procedure for permanent sterilization, which involves the cutting of the vas deferens, which carries the sperms from the testes. It has an archaic history in the medical field, its roots dating back in the 1800s. The fundamentals remain unchanged, but technical advances include implementation of no-scalpel vasectomy.
In 1952, India was the first country to implement its family planning program, promoting various contraceptive methods, including vasectomies. Focus on vasectomy increased in the 1960s due to its cost effectiveness compared to female sterilization. The 1970s was when it had its phase of prominence. It was a year of emergency in India.
Post-colonial anxiety led to forceful sterilization of notably 6.2 million men. The eugenic practices and mishandled surgeries caused death of more than 2,000 men. Such improper state actions led to widespread public discontent and intergenerational harm. The wound was inflicted long ago, and yet the pain lingers.
The government then faced political backlash. The failure of positive and negative incentives, camp approaches, and mandatory sterilization paved the way towards more permanent family planning programs.
A significant fall in vasectomy was noticed from 80.5% in 1960s to 13.4% in 1990s to a phenomenal fall of 0.3% as per recent NFHS-Y data.
This significant fall in vasectomy numbers is yet another example of how a society continues to burden women with responsibility of family planning. The so-called cafeteria approach, which conveniently allows men to not take responsibility of birth control. It reinforces stigma around male sterilization, creating fear and reluctance among men to not for vasectomy.
The pressure placed on women to undergo tubectomy, often immediately after childbirth, illustrates the disproportionate expectations being placed on their bodies. The rise in LSCS and tubectomy happening side by side is no coincidence. Indeed, tubectomy is a compulsion disguised as a choice.
To investigate this persisting social norm, we conducted a cross-sectional structured questionnaire-based study among public visiting OPs and PAC in Karimnagar. A sample size of 200 male, 50 ASHA workers and 50 healthcare workers were surveyed. For generation of real and honest data, the questionnaire were translated into vernacular language. The data was collected using Google Forms, and there was no online sharing of this Google Form on any platform.
Our objectives were to identify the knowledge gaps and attitudes towards vasectomy, to determine the percentage distribution of perceptions and myths among the population, and to correlate our study with the recently observed NFHS data. Men being the primary subject of our study, we found that 91.1% men knew about vasectomy as a method of contraception, of which 47.5% considered to be a highly invasive surgery and 25.2% had no idea about the procedure.
Surprisingly, we found that many people correlated vasectomy with decreased masculinity. Our study suggests that 22.3% of men thought that vasectomy would make them less masculine. We also found that many people believe that vasectomy cannot be reversed, as 46% of men and surprisingly 30% of ASHA workers had this misconception.
With respect to concerns about absence of ejaculation after vasectomy, there was a widespread but incorrect belief of 43.1% men and 36% ASHA workers that there is no ejaculation post-vasectomy. This reveals a shortfall in sex education and awareness at the levels of both ASHAs and the general public.
In response to the queries related to sexual performances in males, 27.7% of men and 20.4% of ASHA workers assumed that vasectomy hinders sexual performances. 32% men thought that it reduces sexual drive and causes uncomfortable sex, and 16% of ASHA workers thought the same. These numbers indicate cultural myths about reduced sexual satisfaction post-vasectomy.
When asked about physical strength as a question of concern, 38% men believe physical strength decreases post-vasectomy and 10% ASHA workers thought the same. In a country like India, where men are the breadwinners and decision makers, they fear losing strength might hinder their ability to work and in turn affect their family income.
While While 52% of men thought that tubectomy is a safe choice, medical data shows that vasectomy is a safer and cheaper option available. A lot of people, 48% of men and 26% of ASHA workers thought there is a long period of pain post-surgery. One of the ASHA workers added, men will take cuts in plead for their family where women will be fearful of the smallest cuts. Our study showed that 76.7% of males and 76% of females were unaware about complications of vasectomy surgery.
For promotion of vasectomy, we need to focus on societal beliefs, misconceptions, and lack of awareness. We need to increase IC on all levels of society and foster communication between healthcare workers and society so that we can empower men to take responsibility of their reproductive health. If vasectomy and tubectomy were facing off, then this would be the ultimate game.
NSV being minimally invasive can be performed as an outpatient procedure. On the other hand, tubal ligation being an invasive can require patient admission.
Local anesthesia is sufficient for NSV, whereas general anesthesia is required for tubal ligation.
Vasectomy is significantly a shorter procedure than tubectomy.
NSV involves a minor cut on scrotum, whereas tubectomy is an intra-abdominal surgery.
The post-operative recovery for tubal ligation is more extensive than that of NSV. It generally allows for a quicker return to normal activities.
After NSV, it is common for patients to resume their sexual activity within few days, unlike tubal ligation, which requires complete healing of the incision first. Although vasectomy does require use of temporary contraception initially during the act of coitus.
The cost of NSV is typically about a quarter of that of tubectomy.
Tubal ligation is more complex to reverse when compared to vasectomy.
Vasectomy complications being of minimal risks include pain, infection, and rare cases of vas deferens reconnection, while tubectomy holds higher risks such as pain, infection, bleeding, anesthesia-related issues, and potential damage to surrounding organs.
Vasectomy is a complex issue involving myths, politics, and patriarchy. Addressing the gap in awareness and practice of male sterilization, we mainly observed misconceptions surrounding vasectomy, gender bias in family planning methods, and inadequate healthcare facilities, leading to a lack of proper education and access.
Our team devised a few solutions to increase the awareness around vasectomy. Half knowledge is worse than ignorance, as it creates misunderstandings. Thus, it is important to provide reliable information in a supportive setting with descriptive illustrations and practical props. This can help in clearing the misconceptions.
Taboos and sexual matters go hand in hand in India. During the process, we encounter a handful of responses wherein people consider the discussion as explicit and lewd. It is important to provide comprehensive sex education to prevent such occurrences.
In the course of our survey, we observed that men were reserved to speak with our female colleagues. This was not the case with our male colleagues. In rural areas, most of the healthcare workers assisting in family planning are females. This creates a barrier between them and creates an obstacle between the respective couple. Therefore, male healthcare activists should also be employed.
These tiny actions, while seemingly minor, can have a substantial effect. We adopted these practices and met with these transforming experiences.
We sat down with the subject and used a simple diagram to explain how male reproductive system works. We showed them two tubes, one which carries sperms and another which carries most of the seminal fluid. We explained that during vasectomy, we only cut the tube which carries sperms. This means that after the procedure, men can still ejaculate but without sperms. This simple incident enlightened us that explanation of simple procedures to patient can bring forward a positive change in perspective, that men can take control of their family planning without losing intimacy.
Ravi and Priya were at odds over who should undergo sterilization. Ravi hesitated due to misconceptions of vasectomy, whereas Priya thought that tubectomy was the only option. We explained the pros and cons of both methods. Safety and simplicity of vasectomy changed their perspective. Empowered by the knowledge, they decided to choose vasectomy together.
Breaking free from the societal norms, they abandoned their original plans and dared to defy the status quo. Thank you.
I just had one observation, very well presented. Now, one observation, was this loss of male virility the idea of the men or the women also? Did you ask the women whether a vasectomy would lead to her husband decrease in virility? Or did you only ask the men, would it lead to a loss of virility? You said that men believe that vasectomy can cause a loss of so-called manliness.
Thank you so much, sir. It's a really insightful question. Actually, we conducted survey on 50 women as well. As per a research paper from Bihar, it's seen that many of the women also feel that men would lose interest in sex post-vasectomy. Therefore, they were not permitting their husbands to undergo vasectomy. Our major study was on male population of 200 people. But yeah, we also conducted a study on women.
Now, I read that paper. The reason for women not accepting their men to have vasectomy is to prevent them from becoming philanderers. Did you understand what I said? The man would be more frightened of having sex with several women simultaneously, okay, or clandestinely, simply because the woman would become pregnant and the truth would be out as to who the father is. So the woman who is married has a greater control over the man from becoming somebody who is wandering around the country, okay, impregnating women. That is the reason in the Bihar paper which was given. If my man is sterilized, he is more likely to wander around. That was the reason given, not the other way around. No loss of manliness.
Yes. Thank you so much, sir. It's a really great point.
Yeah. As rightly said, that's one of the observation in the Karimnagar, one of the districts, highest rate of vasectomy. You know the reason why it is highest in the state, in the district of Karimnagar? District.
Ma'am, can you please repeat the question, ma'am?
The rate of vasectomy acceptance is highest amongst all the districts, highest in Karimnagar. What could be the reason? Are you aware of that fact?
Yes, ma'am. Actually, the paper has been published by our own professor, Dr. Venkatramana sir, that...
what is the reason behind it? Why the men are so...
Ma'am, actually, I think that the percentage of ASHA workers who are knowing this information is more, and also the frequent vasectomy camps which are being organized in our civil hospitals every Monday.
The fact is, in one of the papers it has come, not only papers, in the publication, as sir rightly said, they can wander around. There are a lot of migrants in the district of Karimnagar. So if they migrate to other places, they are safer. Even they can have free sex without making anybody pregnant. That is one of the reasons. Only in that district it is the highest. So that should not be the motive. So how do you want to bring the behavioral change in men? Do you think it's so easy to change the thought process?
Thank you, ma'am, for the I appreciate your question. From the outlook of a woman, the woman gives birth to the children. She undergoes tubectomy.
Behavioral change in the men. See, you have done a very good study, but you should have been having some thoughts by now, how to bring in the behavioral change in the men. Can you just tell few things?
I would like to add to that point, ma'am. Our study is it majorly focuses on how to increase rates of vasectomy in married couples who have achieved the desired number of children.
But you should come up with some strategies to bring in changes. See, ultimately you want to bring some change, behavioral change in the men. So you'll be having some thought process by now.
I would like to add this to ma'am. We went through all the campaigns that have ever been created for vasectomy. So in that we found a very good campaign that was shown in TVs by DD News that influenced a lot of men regarding vasectomy operations. It showed that men are still men. They don't lose power after vasectomy. The similar kind of campaigns.
How do you plan to bring a behavioral change in the thought process? So I feel the male doctors who have completed the family, they should get vasectomized and they should display in the hospital that so many men had vasectomy. Why not the doctors become an example? Why Bahubali has to become, he didn't even get married. Instead, you should become the role model. The male doctors should get the vasectomy done.
Instead of some, you have seen actresses coming forward and saying, I had breast cancer and I'm cured of it. You heard of sports person coming out and saying, I had mediastinal germ cell tumor, I went through chemotherapy and surgery. So they act as role models for them. Have you ever heard of a cinema actress coming and saying, I had cervical pap smear, I had a HPV test, I had a HPV vaccination, I had cervical cancer and have taken treatment, I am cured? No, it is not fashionable. So the association even amongst men and women is women and breast cancer. They don't associate women and cervical cancer. It's a taboo. So what madam is trying to tell you is, you need to promote against this taboo. You need to make examples of people who are looked upon as heroes, as role models, to say, yes, if Shahrukh Khan comes out and says, I had a vasectomy, I am still a man, I think hundreds of boys will go and men will go and have vasectomy. This is what madam is trying to tell.
This is exactly a great point, sir. But I would just like to give some examples. Arnold, who was shown in the clip, and also the actor who played Superman, Henry Calvin, they both have undergone vasectomy, yet they remain the, what we call, epitome for par in all our movies. Also, I think that if we keep spreading awareness, there might be Bahubali 3 in which he will surely get vasectomized.
I would like to add on that point, ma'am, that Bahubali that was shown was not to show that he has undergone vasectomy. We were just trying to show that many people have misconceptions around vasectomy, so much so that they are not coming up to do it. So we have shown a powerful hero like him beating up the myths and misconceptions and coming out of them. So our hero was a vasectomy coming out with awareness, ma'am. Thank you, ma'am.
Yeah, ma'am, you're asking.
Okay, I would just like to congratulate you and see, we get your point, but I think what I believe is that you have brought up a topic which is not commonly discussed, and the first step would be awareness. So the film actors coming out, the male actors coming out and saying that I have undergone a vasectomy, that's probably a thing of the future, won't happen now. But that's what madam was suggesting, which is a good thing. Like Amitabh Bachchan, polio, people take OPV, like that, and we eradicated polio. So that day will come surely. Probably we can daydream about it and we can reach that 5 years down the line. But thanks for raising this topic. And the first step would be to create awareness. Simple awareness is also important. Many people are not aware of the thing. So congratulate you for the presentation.
Thank you so much.
Thank you. Thank you, ma'am.
That was a nice presentation, and it's very good thing you have pulled up a great topic to present. My congratulations to you guys, and
Thank you, sir.
definitely not the older generation. The younger generation is going to be vasectomized by your presentations. Thank you so much.
Thank you so much.
Thank you, sir.
A very apt and relevant topic. Usually, the people tend to ignore such topics. You have presented out in a good way with a good research topic. Okay, congratulations. Nice presentation.
Thank you so much.
Thank you, sir.
Thank you, sir.